Hi, and welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat, and this is another episode of Behind the Sessions. And on today's episode, I'm going to be talking about an article that came out in JAMA Internal Medicine about maternal mental health in the United States. It made some headlines a few weeks ago, and I wanted to look a little further into it and try and give a little bit of a sense of what this study was about and summarize some parts of it if I can, and really what came out of the study and recommendations for next steps. I'll just give a little bit of a disclaimer at the beginning that this is a summary of the article, not all of the information from the article. And if you want to read this study yourself, you can do so. First things first, though, spoiler alert, the findings are sobering, but they're also pretty validating. A lot of us in the field and a lot of people who feel the decline of our mental health in general really appreciate the validation of a study. And also it's our felt sense already, a lot of people's felt sense, and it's nice to have an article validate things that we are feeling. Some of the key points and reasons that this type of study is really important is that the rising maternal morbidity and mortality in the US is well documented, but limited data exists on maternal health beyond the perinatal period. And this study aims to fill the gap by analyzing self-reported health, as well as to examine recent trends and disparities in maternal, physical, and mental health, and focus on female biological or adoptive parents of children ages 0 to 17 years old. So in this study, they analyzed data from over 198,000 mothers in the U.S. from years 2016 to 2023, using the National Survey of Children's Health. It looked at self-reported physical and mental health, which is basically how moms rated their own well-being. And what this study showed was that the number of moms who reported excellent mental health dropped pretty dramatically from about 38% in 2016 to about 25-26% in 2023. And again, you can go to the article for the specific percentages. But the percentage of moms reporting fair or poor mental health rose from about 5.5 to 8.5, which is over a 60% increase in over 8 years. And what's really interesting is that these trends cut across all socioeconomic groups. Mental health declined broadly, regardless of income, race, or education. And, we see in perinatal mental health that it does not discriminate. People of all races, all ethnicities, all socioeconomic status can experience a perinatal mental health condition. However, there are some factors, both in this study and in general, that make these risks and potential outcomes worse. So in the study, moms who were younger, single, US born, less educated, or were raising publicly insured or uninsured children had significantly worse outcomes. So similarly to what we see already in perinatal mental health is that people with less access, people with less support, people who have a higher stress, and some other factors also potentially have worse outcomes when it comes to perinatal mental health. So COVID made all of this worse, but this decline that they're discussing in the study happened before the pandemic. But importantly in this study, the disparities in mental health outcomes was that mental health declines occurred across all socioeconomic subgroups, lower health status among US-born mothers, single parents, and those with lower education, and significant disparities in health based on child insurance status. And I think this study is also timely because while it has always been more challenging for people with lower income and who didn't have access to insurance, right now in our current climate, these resources are at risk of being taken away and are being taken away. So people who are already experiencing these disparities and experiencing the impacts on them and to their mental health are potentially going to be even experiencing more and getting even worse because the supports that are in place, however limited they are at risk and are being taken away. So overall, with this study showing that there's been a significant decline in self-reported maternal mental health from 2016 to 2023, It's showing that we need more investment into underlying causes of mental health decline, especially for lower socioeconomic status moms. So while the study doesn't identify one single cause, what we know from some research and lived experiences is that the mothers in this day and age are overloaded and under supported and are often carrying the invisible labor, managing the household and chores, emotions, appointments, meals, everybody's needs, including oftentimes their partners, without consistent support. And in some ways, because there's not consistent support, either because that's, what's happening in the household, or because support isn't available close by, like family members live far apart, or friends even live far apart, there's a lot of isolation as well. So lots of moms feel emotionally and physically alone. Sometimes even when they're surrounded by people, it's the type of support is what matters. Support that feels supportive is what matters. In a lot of ways, because we don't have the village that we so desperately need, we're meant to feel like, we're supposed to be doing this on our own, only because we are doing it on our own. But the case is that we're supposed to have support. And that really heavily contributes to mental health and wellness, to not have that support. As we talk about a lot on this podcast, is there are expectations in motherhood, cultural expectations, that good moms are the ones who self-sacrifice and are always grateful and shouldn't be struggling and always have a smile and are fulfilled by motherhood in all of these ways. And while that might be true in some ways, it doesn't mean that people aren't also having a hard time. The two things can be true at the same time. That on one hand, somebody could be very grateful and could be happy that they have children and that they get this chance with this child or this opportunity, or that this is what they've always wanted. But we look and view motherhood in black and white terms. You can also be stressed out. You can also be overwhelmed. You can also be struggling. At the same time, they do not cancel each other out. And we have to have a more holistic view of what motherhood is, because moms are suffering under the weight of the silence that ensues because we have this pressure to feel like everything's okay. And so what happens with silence? Shame grows, and also stigma grows. So if we're not having real conversations about how motherhood is really impacting people, especially with the number of stressors that are just sort of in the air and all around us, then it becomes shameful to ask for help. It becomes, or can feel shameful anyways. You can be embarrassed about asking for help, or worried that people are going to think you can't do this thing called motherhood. And the more silence there is, the more isolation there is, the more stigma there is, the less support moms are getting. So conversations like we have on this podcast are extremely important, because there might be somebody out there, listening to this podcast and hearing her story reflected in somebody who's sharing theirs on this podcast, and finally feel like, oh my gosh, it's not just me. There's a little bit of hope there. And oh, there is a resource for this. I didn't even know. Because, if there's stigma that is suppressing the conversation, then of course you're not going to also know that there are resources available. And then certainly, like, taking a huge step back and looking at systems of care, there are a lot of barriers to care, a lot of barriers to having a supported and reduced stress experience in pregnancy and postpartum. We do not have guaranteed paid leave in all states, and the states that do have them are definitely working on it, but it's still not ideal. It's still limited. There is definitely limited access to affordable childcare. We're still working on bolstering our screening processes for perinatal mental health and making sure that people get to the right resources and that symptoms are picked up on. But a lot of systems in healthcare are siloed. So one, doctor might not be able to talk to another, or isn't talking to another for whatever reason. So there's not a lot of continuity in care for people who are in this perinatal period. Again, I think these ideas that, I expanded on and added to from the study for sure, reinforce something that we already feel in our bones, that being a mom is hard right now, that we're not imagining it. And having the validation of a study like this is incredibly important because first, it gives us data that there are national representative numbers that show maternal mental health is a public issue. And the data is important so we can use that for one as at least even at minimum a benchmark for how are we doing if we're looking at these numbers at another time. It gives us information so that we know where we're at and we know where the needs are, at least some of them. It definitely pushes the conversation beyond just postpartum depression, or at least just about the first 6 weeks or even the first year. We know that maternal mental health challenges can persist or even get worse if left untreated. And some studies show that can peak in around 4 years if not treated. Certainly there are some cases of spontaneous recovery or, getting the support and feeling better. But there's such a wide range of experience that we need to be taking into consideration. And a lot of people fall through the cracks, don't get the support that they need, or sort of get to a space where they function well enough that they can get through, but they're not functioning as well as they could be. Another reason this study is important is that it provides information, data, and potentially fuel for policy change. This information can be used to demand or ask for more investment in maternal mental health care, for more accessible services, for paid leave, for culturally responsive supports, for potentially affordable childcare. And the list could go on and on if you just let your mind go with it. There's a lot of ways that this data can be supportive of making positive change, especially because we know that when maternal mental health, perinatal mental health isn't addressed, that, and, goes on and continues to impact people, that maternal mental health can impact or affect birth outcomes, potentially child development, and impact a family long term. And that is why getting to somebody, ideally even before they're pregnant, when they're thinking about becoming pregnant, but certainly during pregnancy and absolutely during postpartum, to make sure that they have adequate support, that we're helping them to have the best potential possible mental health during that period of time, because it's not only good for them, it's good for their kids, it's good for the family. And certainly, right now we're talking about moms, but we should be talking about partners, and like the whole system is impacted by stress. And the more support that we can give to the system, the better off for everyone, not only right now, but potentially generationally. And I wonder how for you out there who saw this article or read the study, or even just heard about the study, even just the title of the study, if that helped you in any way, if it validated what you are feeling in your bones, to be able to see that, yeah, what you've been feeling is actually happening to other people as well. I think it's incredibly important to know that if that is you, that you are not weak. Struggling is a real part of this experience, especially when all these structural societal factors are at play. We haven't even talked about politics, but I imagine that's a contributor. It's important to know that you are having a response to something that is happening in real time. You might not be able to always put your finger on it. You might not be able to say, well, this, and that are exactly the reasons why I don't feel well, or why I feel anxious or on edge, or you have a pit in your stomach. You need to know that that is not weakness. It's a response. Your body, your mind is responding to something that is very real. You're not broken. You are having a very human experience. And talking about it, finding somebody to talk to about it, somebody that you trust, somebody you feel close and connected to, or a therapist or a support group, those are ways that once you start speaking on it, speaking about it, can at least reduce a little bit of the stress, knowing that you're not alone, getting it off of your chest, not holding it in, and being able to, however you need to be held and heard and seen in your experience. And if you're looking into therapy or you don't even know where to start, Postpartum Support International has a provider directory in all states and some international as well, where you can go on there and look in your region and filter out for the type of insurance you have and other factors that are important to you, and try and find a therapist that's near you or that you can see on Zoom in your state. There are definitely therapists who are working online, but definitely also in person. And finding that kind of help is incredibly important. We all need an outlet. We all need a safe space. And if that's not where you're at right now, then just even texting or calling a friend can be a good first step. Another thing that we talk a lot about on this podcast is being able to identify what your needs are and ask for them. Or even if you can't ask for them to be met, to make arrangements with yourself to have them met. So, like if you need a break, if you're overstimulated, you're overwhelmed, you're overworked, it is okay to stop doing as many things. It's okay if, that pile of laundry doesn't get folded, or you forgot to make that appointment for somebody, or that you just need to have a day where you lounge around and do the bare minimum. All of those things are okay. But like we can choose rest. That is an option. Nothing bad is going to happen, inherently if you rest. Although anxiety and depression and, other factors might be telling you that you can't or you shouldn't, or whatever the narrative is, you're lazy or all that ridiculousness. You absolutely can have a break. You definitely can rest. It is not selfish. It is not lazy. It is just human. And it doesn't mean that you're going to need rest forever, but you might need it off and on. Things don't need to be perfect right now, and they never do. I'll just say that. But this might be a time in your life where rest is necessary for your healing, for your recovery, for your spirit, for your mental health. And that is important. We've been told that rest and fun and play are something that you do after everything else is done. And that's just not true. It doesn't have to be that way. That's not how things are done all over the world. It's not some like inherent truth of the universe that you have to do things that way. If you're tired, you can rest. If your body is telling you that you can't do one more thing, listen to it and go sit down, stare at a wall, watch TV, listen to music, something that isn't just about being productive. And of course, my plug is always for self-compassion, for validating your own experience, for you to allow yourself to have the same compassion as you would for somebody else. Just turning that a little bit towards yourself. You know that if you saw somebody or heard about somebody that you care about in your same position, that you would have compassion for them. You wouldn't be as judgmental as you might be to yourself. And furthermore, we cannot continue to put the pressure on the individual, on the single one person, to feel better within a system that is not supportive, that burns people out, that doesn't provide the necessary support, that, as a matter of fact, puts mothers down in a lot of way, belittles them by viewing their job as, not as important. We cannot self-care our way out of a system like that. So the things that you can do for yourself are what's within your control and your power to some extent. Definitely, we all have limitations depending on your circumstances. But doing what you can do for yourself is important. And for those of you who have been conditioned out of thinking about what your own needs are, to the point where, you think about other people first all of the time and don't include yourself on the list at all, This is a skill. It's a hard thing to switch over to do, and it's also necessary, especially in a system that is sometimes looking out for you, but also is adding pressure and stress to you. And again, more broadly, what we need societally, culturally, we need to make sure there are routine mental health screenings for moms, partners, dads, all birthing folks, and not just once, but throughout the parenting journey. Definitely the perinatal period is a vulnerable one, but the first year is a vulnerable one, and all of parenting in a certain way can be vulnerable and can have its challenges for a lot of different reasons, many, many different reasons, whatever your circumstances are, could be contributing to the stress that you have. And just because you have a kid who's a toddler doesn't mean you're not, potentially still dealing with mental health challenges. And of course, if possible, given this sort of state we're in right now, not extremely possible, we definitely need more research looking at what is happening, especially for marginalized moms, both socioeconomically and culturally and ethnically, and people who have historically been underrepresented, and certainly how racism impacts motherhood. All of these things are incredibly important to make sure there's inclusive research and not just, a one-off here or there. And then, of course, acting on that research, being able to implement things through policy changes that impact public health and beyond. And ideally, that includes employers and communities and partners and everybody to join in. As I mentioned before, the family system is what we're talking about. And often mom is at the center of that system, doing a lot of the stuff to make that system function. But that doesn't mean that, the partner is just a helper. The partner is part of the system too. The kids are part of the system. And if we can keep the system, the family system, healthy and supported, then everybody benefits. But moms do feel alone. They do feel the pressure. And the more we can talk about perinatal mental health, maternal mental health, and how mental health impacts the family, the partners, the dads, any birthing person, the more we can talk about the systemic factors that are absolutely contributing to the decline in maternal mental health, the more awareness we bring, the more action we take, the better off everyone will be. So I'm going to keep talking about it here. A lot of organizations are talking about perinatal mental health, putting out training, putting out resources for people who are suffering. And with all of us talking about it, raising the volume, making it more known that maternal mental health and perinatal mental health is a thing that exists and it has real impacts. And the more we can work towards not just having awareness and talking about it, but making real change to support people, both on individual levels, community levels, state levels, national levels, every level. This is at the core of our society. This has to be a priority. And thankfully, with studies like this that came out in JAMA, we can use this to bolster our work and continue to support moms and families and birthing people to ideally have a healthier society. So thanks for joining in on this. I'll have a link to where you can find out more about this article in the show notes, so you can go and look at it for yourself and read that study. But in addition to that, please share this episode with somebody so that they know that they're not alone, so that they know that there are people thinking about this, looking into it, working towards getting the resources and support that perinatal folks really need. Thank you so much for joining me. Until next time.